Hello, thank you so much for joining us this afternoon. My name is Dr. Brian Berman. I'm pleased to welcome you to the webinar today. As chair of the Movement Disorders Division at VCU Health and the director of the Parkinson's and Movement Disorders Center, located here in Richmond, it's important to keep we feel it's important to keep our community informed and connected. And this webinar is intended to educate our patients about the spectrum of mood disorders that commonly occur in Parkinson's disease. And this, I think, is a really important, we know that we sometimes think of Parkinson's, that the movement symptoms are the tip of the iceberg, and really it's these other symptoms below the surface that are not visible that can really mean so much to patients and impact disability and quality of life. So we will start out today with a panelist interview, but we'll be sure to leave time at the end for questions. And if you'd like to share this information from this session with a friend, please know that we are recording this webinar and we'll send out a link to the recording in the coming days. So today's session, like our other recent webinars, has been made possible by our wonderful partners who are joining us today, Gary Rogliano and Margaret Preston from the Power Over Parkinson's Foundation. And since 2019, really, we've partnered together on things and activities like this webinar, and more broadly, to improve the lives of people living with Parkinson's disease. And this is through exercise and wellness programs, social activities, and peer-to-peer support programs. So now I'd like to ask Gary and Margaret, can you take a moment to tell us a little bit about your mission and some of the offerings that you have for Parkinson's patients?
Yeah, thank you so much, Brian. Thank you for having us. We're excited for another great session. As some of our listeners may not already know, my father sitting next to me was diagnosed with Parkinson's 4 years ago. He was always a proponent of exercise, but anybody who was diagnosed became even that much more interested and a proponent of exercise and physical fitness and wellness, etc. And with that in mind, we decided to start Power Over Parkinson's to provide opportunities for exercise and wellness for other people living with Parkinson's in the Central Virginia area. So with this in mind, we created POP. We've got a lot of offerings, including exercise, socialization events, including our Parkinson's Activity League, online series, educational sessions on our YouTube channel. And of course, we're holding on to our Zoom workout every Saturday for those folks who still feel comfortable in that space as well. And with that, I'll turn it over to my dad.
Thank you, Margaret. And for those of you who are not familiar with POP, I encourage you to go to our website at poweroverpd.org. With that being said, let's turn it over to Leslie to hear from our panel of experts. Thank you.
Okay, so I'll go ahead. So we invite you to submit questions to us throughout the program, and we'll try to answer as many of the audience questions as possible. At the end of the program, we'll try to answer as many as we can at the end of the program. To ask an anonymous question, please use the Q&A feature here in the Zoom toolbar at the bottom of your screen. And so without further ado, let's get started. So for start, I think we should get a brief introduction to depression in Parkinson's disease. And so Dr. Parkinson, could you please tell our audience what are the signs and symptoms of depression in Parkinson's, and how psychologists and physicians diagnose it, and just how common is it?
Yeah, thank you. That's a good place to start. So what do we mean by the word depression? First of all, I want to note that everyone has times in their life when they feel sad or they feel down. And to a certain extent, that can just be a part of normal life, dealing with difficult things that happen in life. But when we talk about depression, or the medical term depression, we're referring to something that's a more persistent state that's lasting weeks or longer. And not only does it last longer, but it's affecting someone's ability to do things in their life that they would normally be doing. So it affects their functioning, important aspects of their life. At that point, we would begin to call it depression as a medical term. When most people think of depression, they think of the main symptom they might think of is sadness. But there's other symptoms that can also go along with depression. In fact, sometimes people don't describe their depression as being sadness. Sometimes it's more irritability or loss of interest in things that would typically interest them, or loss of pleasure in things that would typically be something they'd enjoy, or decreased energy. Those are some other symptoms of depression. Also, pessimism or discouragement or feeling hopeless. Those are all things that can be a part of depression. According to the Parkinson's Foundation, more than 50% of individuals with Parkinson's disease will experience some degree of depression during their illness. And as Dr. Berman mentioned, depression and mood symptoms can sometimes be a big part of a person's illness, and sometimes play as big of a role as their motor symptoms themselves. When I think about depression in Parkinson's disease, I think that there may be kind of two factors involved in what causes depression and kind of high levels of depression or frequency in Parkinson's disease. First of all, there's a lot of stress associated with the symptoms that are going on. And there's a lot of changes in life and adapting and adjusting to those symptoms. So that can naturally be a big stressor. But also, I think another important thing to note is that Parkinson's disease itself can affect brain functioning, and it can affect the chemicals in the brain that are related to emotions and behavior and mood. Sometimes when I meet with people who have Parkinson's disease, they may have already had times in their life before their Parkinson's where they experienced depression. And so in those cases, they might easily identify it when it happens again. But there's other people who have never experienced depression in their life, and they might, after their diagnosis, start experiencing some depression, and it's kind of new for them. And so they might need more help identifying what's going on and figuring out what to do about it. I also want to stress that not every person who has Parkinson's disease will experience depression. But when it does happen, it's important to be aware of it. It's important to identify it and find out how to help. So the other part of your question was, how do we diagnose depression? The first step is just talking about it. So as a psychologist, and as part of our interview, we talk frankly and honestly about what the symptoms are and ask the person how they've been feeling and different symptoms they might be having. Sometimes we ask them to fill out questionnaires that can bring out other details, things they might not have thought of. And sometimes involving a family member can be helpful to get their perspective on things as well. So identifying depression can sometimes be a process, not just a one-time conversation, but sometimes it can take some time to identify what's going on and to understand how the disease is affecting people and how depression may or may not be playing a role. But it's important to identify it, to find ways to make life meaningful and purposeful.
Indeed. Yeah, thank you, Dr. Parkinson. That you touched on a lot of great points. Dr. Cloud, why would it be important to recognize and treat depression in Parkinson's disease patients? And how do you as a physician approach the treatment of someone with depression?
Yeah, so in addition to some of the things that Dr. Parkinson touched on with regard to the treatment of depression, improving people's engagement in their life and quality of life, there also can be a negative impact of untreated depression on the motor aspects of Parkinson's disease. And so from my perspective as a neurologist, it can be really difficult to get people's motor symptoms under control if they have significant depression that's not well managed. And so it's important on sort of face value for, its obvious direct effect on people's quality of life and engagement in their life, but it also can impact motor symptoms negatively. And then for the second part of your question about how I, as a neurologist, approach the treatment of depression, I sort of see my role as being twofold. Number one, I see myself as being often the conduit through which people get to someone like Dr. Parkinson or Dr. Loggeman to seek therapy for managing their depression. And so oftentimes the referral comes, from the neurologist to the psychologist or psychiatrist in some cases. And then also if there's a need for using medications to try to manage the depression, that's where the neurologist or the psychiatrist may come in. So I do a lot of prescribing of antidepressants in my clinic. And for people with more complex or difficult to treat depression, I often refer to my colleagues in psychiatry for more sophisticated and advanced help.
Thank you, Dr. Gladys. That's very helpful. Let's see, Dr. Loggeman, how do you as a psychologist help treat depression along with those ideas that Dr. Cloud just raised?
Yes, as Dr. Cloud said, there's medications that can help, but talk therapy can also be very helpful. And sometimes people will use one or the other or in combination for various personal reasons. But I think therapy has the potential to really help you make changes that can be lifelong skills that you learn and use. And so that can be helpful. One major type of therapy that's been shown to be very empirically validated for treatment of depression is cognitive behavioral therapy. It's called CBT, and it looks at how your thoughts, your moods, and your behavior all interact. And so that therapy involves a lot of delving into how those things interrelate and what you can do to intervene and change your mood and help yourself feel better. I've noticed working with people with movement disorders that there's a lot of giving up of activities and interests and social connections. And that loss over time, I think, can really lead to some depression. So in a lot of therapy, I'm exploring with people how they can get engaged or explore new interests or hobbies, social avenues that are so important, just like what the POP does or other programs. There's lots of other exercise and social classes that can be very helpful. And we also, of course, talk about patient goals and values and trying to help them live their best lives possible, even though they have something that they deal with that they obviously wouldn't have wished for, but to still have a productive, happy life.
Thank you, Dr. Loggeman. So it really seems, there are lots of different approaches that can be applied to try to help people deal with depression. And I think it's very important to seek these out and know that this is not something where there isn't anything we can do about it. So appreciate all the suggestions. So let's talk about another common condition associated with Parkinson's and associated with depression, and that's anxiety. So Dr. Loggeman, could you tell our audience what are the signs and symptoms of anxiety and how are psychologists and physicians able to diagnose it? Also, how common is it?
Sure. Anxiety is a little different. So we all have probably experienced anxiety at some point in our lives, but it is this state of uneasiness and apprehension about the future. There can be lots of different signs of anxiety. So emotional signs could be difficulty relaxing, irritability, running thoughts or ruminations where you just can't keep thinking about something and feeling worried or nervous. But there's also cognitive symptoms. You can have great distractibility, difficulty focusing, and forgetfulness. And physical symptoms may be what you're more familiar with, where you have fatigue, difficulty sleeping, muscle tension. A lot of people get tension in their shoulders or get hot headaches, and shaking or tremor can happen. As you probably can see, just listening to those, you think, well, gosh, those are a lot of symptoms of Parkinson's that we're talking about. So you can have problems with attention or shaking with Parkinson's. So the identification of anxiety is something that's a little more tricky. I think checklists are not our friend in this situation just because of that overlap of symptoms. So you really do need a clinician that can work with a person to talk about how they're experiencing the symptoms. So as we all know, you can have tremor that's just physiologically happening, or you can be very nervous about something and shaking. So you have to tease that apart. About 40 to 60% of any patient population with Parkinson's at any time has anxiety. So it's not everyone. And I think that's important to note, because that means 40 to 60% are not having anxiety too. But it's also important to note that anxiety can come from physiologic changes in Parkinson's, but it also can come from reactions and adjustment to the illness. So especially if people experience freezing or off periods, they can be very anxious, become very anxious about how their medicines will work and what kind of day they may have. And just that unpredictability can be very stressful for people and produce a lot of anxiety. So.
Thank you. Yeah, you touched just a little bit about how anxiety might affect memory and thinking. And I'm wondering, Dr. Parkinson, how is anxiety related to underlying executive function or problems with thinking?
Yeah, so it's a great question. And I think, first of all, let me describe and define what executive functioning is. Many of you might know what I mean by executive functioning, but it's an aspect of cognition. So it's part of our thinking skills. Other thinking skills include memory and language abilities, visual perceptual abilities, attention, but executive functioning includes a lot of things. It has a lot to do with being able to organize your thoughts and your plans, being able to plan ahead, being able to keep track of a lot of information at once, and to juggle that information in your head, and to switch what you're thinking about from one thing to another without getting overwhelmed. It has a lot to do with in complex situations, whether you're able to kind of juggle all the information you need in order to keep organized with things. When I talk with and work with people that have Parkinson's disease, often the way they describe how this is manifest in their life is things like losing their train of thought, feeling overwhelmed or having trouble keeping up, especially if there's a chaotic situation, a lot of people coming over for Thanksgiving dinner, or just a lot of people in the home, or a lot of things that you're not used to, they're unexpected, trouble switching gears from one topic to another. And these things can be quite frustrating. Difficulty with multitasking is another common way that people describe it. And naturally, they're be frustrating for anyone when you feel like you should be keeping up with things cognitively, but you feel like you're not keeping up quite as well as you normally would. Sometimes I think about that as kind of with an analogy of, it's kind of like juggling. Maybe you're pretty good at juggling two balls and you're really good at being able to make those switches. But what happens when somebody throws you a third ball and you're not used to juggling three balls? Especially if there's a lot of pressure on you to juggle three balls, that's going to result in some anxiety. You're going to feel frustrated, you're going to feel anxious. And that's kind of what happens sometimes mentally when there's too much going on, or you're trying to juggle too much in your head. It might also be kind of like, if you think about your brain as being kind of like a workbench, and if you're trying to do something on your workbench, like you're fixing a lawnmower or something, and you're spreading your parts out on this workbench and your tools on this workbench, but it's not a big enough workbench and things keep on falling off. That's frustrating. That would be really frustrating. And sometimes that can happen mentally too. So it's kind of like a workbench, or kind of like juggling. And so I think there's some key things to keep in mind if you experience that can help. I think one of the most important ones is to pace yourself, and to realize that you might have to do things at a different speed than you used to, but you can still get things done. So by pacing yourself and being organized in how you approach things, so that you can approach things kind of one step at a time rather than trying to juggle a lot of things at once, then that can also help with anxiety and helping to feel less overwhelmed. Another big thing that can help is to have more structure. Sometimes just having a to-do list where you have everything out on a piece of paper and you can approach things one at a time instead of having a lot of things in your head that you feel like you have to deal with. So I think there's some of those key kind of simple ideas that can help reduce anxiety when you're feeling anxious because of these cognitive issues.
Great, yeah, thank you. Really appreciate those metaphors, which I hadn't heard before, to really help understand executive functioning, and yeah, interesting to hear about how anxiety can relate to that. Dr. Lagerman, how do you as a psychologist approach treating someone with anxiety or patients with Parkinson's disease and anxiety?
Anxiety is a little different than depression. So I think for mild anxiety, it's really best treated by therapy because anxiety tends to grow to fill whatever room you give it. So it can just keep getting worse and worse. And I think learning behavioral strategies to really help you control your anxiety can help when it's mild. By behavioral strategies, I mean things like different relaxation strategies. I work with people using deep breathing, guided imagery, or progressive muscle relaxation in their body. There's also thought stopping techniques that people can use, or mindfulness skills. And these are all skills that can help you and really help you throughout your life with any anxiety that you experience. So what I would caution people about is you often have mild anxiety, but then where you might have anxiety, for example, like going on a big trip and keep limiting how far you're willing to go from home, it may become that you're just restricting your life so much because of that anxiety. And so it really is important to kind of keep treating it. The other key point, though, is anxiety can get to a level that's so severe that you really need medications to bring it down enough for you to be able to engage in behavioral strategies. So if it's severe, you kind of need that combined approach. But it is something to really work with your doctor with. Many medications for anxiety can be habit forming and kind of have some major negative side effects. So that's important to talk to your doctor about.
Thank you. Appreciate that. Thank you both, Dr. Slagerman and Parkinson. Question for Dr. Cloud. As a movement disorders specialist, how do you approach the treatment of anxiety in Parkinson's patients, I guess specifically with medications?
So the first thing that I typically do is try to sort out whether or not I think someone needs medications. So as Dr. Lagerman said, anxiety is a normal thing that we all experience, and it can actually be helpful to us at times and appropriate. So I think I first try to sort out if I think someone's anxiety is sort of appropriate and normal for their situation, or if it's, as again, as Dr. Lagerman said, if it's becoming really intrusive such that, it's not fleeting, but it sticks around for, very long periods of time, maybe a day or more at a time, or it's limiting people's activities, they're avoiding doing things that they would otherwise do because of their anxiety. So if I feel like someone really needs to treat their anxiety, again, I would echo what the others said. If it's mild, oftentimes a referral to a therapist can be all that is needed. But oftentimes medication can really help to sort of make that therapy more effective and to just sort of help turn off that switch that sometimes gets turned on. And it can be just very difficult for people to, pull themselves out of it once the anxiety takes over. So medications for anxiety, there are many, just like there are many different types of medications for depression. I try to choose one based on many factors, and this is true for depression too. So we look at, the individual's other medical problems, we look at their other medications, and there's no one size fits all. We pick a medication for anxiety or depression based on individual factors. And the other thing that I try to think about in determining how to treat it is the situation that the anxiety is most noticeable in. So, for example, there are some patients who experience anxiety or panic very consistently when their Parkinson's disease medications wear off. It's a non-motor off symptom. But when their medications are on and working well, they don't have any problems with anxiety. And so in that case, it doesn't always make sense to give them an anxiety medication. It makes more sense to adjust their Parkinson's disease medications so that they don't wear off as frequently. So I look at the situation. Is it pervasive? Is it there all the time? In which case it's maybe appropriate to put them on an anxiety medication. Or is it just in certain situations, in which case we might approach it a little bit differently? So these are sort of all the things I think about. I think an important point to make that I didn't make earlier with regard to depression is that typically in Parkinson's patients, depression responds very well to medications. Often doesn't take a high dose, often doesn't take very long. People tend to respond very well. The same is often true for anxiety as well. Although I will say that at least in my own practice, I do encounter more people who have difficult to manage anxiety, I would say, than depression. And so I often will refer to a psychiatrist for additional help with managing anxiety if therapy and the first one or two medications that we try are not effective.
Thank you. That's I think that sounds very logical approach and shows how we have many ways to sort of approach the problem and treat it. The next thing we wanted to move on to is the third condition we were going to discuss today, and this may be less well known to folks on the webinar, but actually it's a very common condition and it affects a lot of folks with Parkinson's. And I really do think it's important to hear about. And so this is apathy. So Dr. Parkinson, can you help define apathy for our audience and also explain how to differentiate apathy from, say, depression?
Yeah, so apathy is feeling less motivated to do things in life, or just having a harder time getting started with doing things or initiating things that you would normally do. Sometimes apathy can be a symptom of depression. So oftentimes people who are depressed have some degree of apathy, but it can also be different. There are people, in fact, I meet with people not infrequently who a family member might be noticing that the person isn't doing as much as they used to, but when you ask them about their mood, they feel fine. So they don't feel depressed. They feel like they're content and they're enjoying their life. And in fact, once they get started on doing something, they enjoy it. They just have a little trouble getting started with it. And so they're feeling apathetic and they have some apathy, but they're not necessarily depressed. So depression can exist with apathy, or apathy can exist without depression. To me, apathy in Parkinson's disease almost kind of parallels some of the movement problems that we can see in Parkinson's in terms of trouble with initiating walking or steps or freezing. So apathy is almost kind of like the mental side of that, where you're having trouble getting started with a mental thing or an activity. Like I said before, sometimes a family member might assume that someone is depressed because they're not as active as they used to be, but they may or may not be truly depressed. And that can be an important thing to kind of tease out. So the process that we go through when we talk with people as psychologists is kind of like with depression. The first step is just having a frank and honest discussion about what apathy is and what depression is and how they're different. Having family members involved in that conversation can often be important. And we also have questionnaires that can help tease those things apart as well. But again, I think identifying it and just understanding the differences is an important first step to figuring out what to do about it.
Definitely. Thank you, Dr. Parkinson. So building on that, Dr. Lagerman, how do you educate patients and their family members on how to deal with apathy in their day-to-day lives?
That's a great question, and it's a challenge. Apathy is difficult to treat, and we find you may give someone an antidepressant, but it isn't really helping the apathy aspect. Their mood can be better, but that apathy and initiation and motivation is not following. What I have found working with patients is that really some more behavioral things have helped. People that go to activities with someone, either a partner or a friend, often tell me that helps commit them to going and getting ready. That going with someone kind of just gives them that push that they're going to go and this is what they're going to do. The other thing that people often benefit from is scheduling stuff in a calendar. So they actually commit, this is what I'm going to do. And in a way, you have to tell yourself, I'm going to do this, whether I feel like it or not. The universal response I often hear is they're always happy they went to the activity afterwards, but that motivation and just intrinsic drive to do it is the struggle with apathy, unfortunately. So scheduling, kind of having a partner or buddy can help. Some mindfulness research we did in the past showed that helped some people with apathy itself, but it is something you really have to keep working with. It's a key thing to keep being moving and engaged in things.
Thank you, Dr. Lehman. Appreciate that. So it sounds like it is a challenge to treat, and I think Dr. Clow, can you tell us about what type of medications might be available to help treat apathy?
Sure. So it's really hard to treat apathy effectively with medications. There really are no standard guidelines because there's just not a lot of evidence to suggest that any particular class of medications is extremely helpful in a majority of cases. So it can also be a challenge, quite honestly, to tease out how much of the presentation is apathy versus depression versus cognitive issues. And I think generally it's usually a mix of, 2 out of 3 or 3 out of 3. So, I think that most of us approach it as, trying to sort out, is there comorbid depression? Are there concurrent cognitive issues? And we try to treat those, so antidepressant medications to treat associated depression. We do have medications called cholinesterase inhibitors that are approved for cognitive problems. And so we often will use those in the context of apathy to treat the associated cognitive issues. And there have been a few studies published in the literature to show that those antidepressants and those cognitive medications can sometimes help with the apathy. So I think those are commonly tried by most neurologists. There are also other things that have been tried in the literature. I mean, basically people have tried to throw just about everything at apathy because we don't have very effective treatments. So a lot of things have been tried. But I think the most common things, we use the antidepressant medications, we use the cognition medications. Sometimes we try stimulants, which can just help people be a bit more alert and engaged. Sometimes doesn't always work, but sometimes we try that. So when it's really bad and it's really disabling, these are the things that we try. Sometimes those things are helpful, sometimes they're not. So apathy, I would say, of all of the issues that we discussed today, is probably the most challenging to clearly identify and treat with medications. I will just say that I completely agree with what Dr. Loggeman said, that oftentimes it's more helpful to have family and friends who understand the apathy piece of it, who will partner with you to encourage you in a supportive way and loving way to do the things that you need to do. And I think that also, as Dr. Loggeman mentioned, behavioral planning is really helpful. So, everyone knows they need to exercise if they have Parkinson's disease. And in fact, Parkinson's disease helps depression, anxiety, and apathy. There have been studies that show that. But yet, if you have apathy, it's hard to motivate yourself to put on the shoes and get out the door and go and do the exercise. So, behavioral planning where you schedule it, you put it on your calendar at 10 o'clock, I go to the gym and I exercise no matter what, that can often be more helpful than any medication that I could prescribe. So I think a lot of what we do is just talking to family and friends about, this, talking to patients about this and trying to help them come up with ways to manage it and, work around it.
Thank you. Yeah, I totally agree. It's a very challenging condition to treat, but appreciate your thoughts and ideas on that. I think those are all valuable to know. This information has been incredibly informative. I really feel we could go on for a much longer time. This is such a short, it's an important topic and we've spent a short time on it. But we've been collecting questions, and so we're going to want to go through these so we can get to as many as we can. And so feel free to continue to post your questions in the Q&A feature on the Zoom at the bottom of your screen. And we're going to start out with a few questions here. If Gary wouldn't mind, we'll start out with the first question from you to our panelists.
Yeah, first one for the panelists. I think my spouse suffers from apathy. Should I try to force him to do things he does not want to do, or should I just leave him be?
So I can take a stab at that. I think Dr. Cloud and Dr. Lagerman have already shared a couple ideas, and I completely agree with your ideas. And I think it's a great question because we often get that question, and sometimes that's the way it feels, is that you kind of have two choices. Either you force them to do something or you just leave them alone. And it's frustrating for a spouse when they know that someone used to be more active, but they're not active now. And it's frustrating to know what to do, how to help, because you love the person and you want to help them. I think, though, it's important to kind of think about, forcing isn't always the best option, and ignoring someone's not always the best option, but what can you do kind of in between? And I agree with the thoughts that have already been shared in terms of some ideas, but I guess another point I want to make is that there's not always a perfect answer that works for every couple, because people can vary a lot in how they like to interact with each other. And the way one spouse might interact with somebody is different from how a different spouse would. And what's appropriate and helpful for one person is absolutely the wrong thing to do with another person. So people that have been together a long time kind of know how to push each other's buttons, but also how to help each other and express empathy. So I think that's important to realize too, is that use the things that you've learned throughout your relationship and your life to know kind of how to be supportive and what the best tact is, whether it's humorous or being better organized or whatever it is. But I agree that two of the main things that are helpful can be number one, structure, which Dr. Cloud mentioned, and I totally agree that sometimes it's a matter of writing down a schedule and saying these are the things that are important to me, and every Monday I'm going to get up at a certain time and I'm going to go on a walk at a certain time. And if you have it written down, it kind of creates a habit and a schedule for yourself, so you don't have to make up things from scratch every day of what you're going to do, and it can help with motivation. And you do it because it's on your schedule, and that's just the way it is. Also, the other thing I think Dr. Lagerman touched on was doing things together with someone else. So it's a lot easier to do something like exercising when you're doing it with another person than when you have to get up and do it on your own. And so a spouse who they could say something like, instead of saying, I noticed you haven't gone on a walk in a long time. I'm concerned about you. Why don't you get up and go on a walk? You could say something like, hey, it's a nice day outside. Let's go on a walk. Let's go together. I'd love to go on a walk. Will you go with me? And that can be an enjoyable time for both people and help create the motivation. And I think most people, once they get out, they're glad they did. They just needed that little spark to get them started.
Thank you so much, Dr. Parkinson. Our next question for the panel reads, does exercise help manage mood problems? And if so, how?
Yeah, I can maybe jump in here. So, and I think I may have said this earlier, there's actually really good data to suggest that exercise is a very effective means of managing depression and anxiety and apathy. When we exercise, our brains get a surge of feel-good hormones and chemicals that can really, really help to improve sleep and mood. And so it is oftentimes all that is needed for, mild anxiety. Just getting out and sweating and getting a good workout on a regular basis can sometimes go a long way.
Thank you, Dr. Cloud. The next one is a bit long, but do you need a psychiatrist or psychologist if you have one of these mood disorders? Or can your neurologist just diagnose and treat them at your regularly follow-up visits?
I can probably take that as well. I think that most neurologists are very comfortable diagnosing and managing these disorders that we talked about today. Certainly depression and anxiety. If someone has more severe depression or anxiety that's not responding to commonly used medications and you've tried one or two without good results, then at that point, I think also most neurologists feel like it's time for you to see a specialist. And so we do rely very heavily at times on our colleagues in psychiatry. So I think that there's no, one size fits all approach. Certainly not everyone needs a psychiatrist, but some people do. So it just depends, I think, on the severity of the mood problems and the response to initial treatments.
Well, thank you again to all our panelists. So we'll go to some live questions. And so we're getting lots of great questions. We'll do our best to get through these. Kind of building a little bit already on what was Dr. Cloud, what you just answered, is when people have anxiety, say they have anxiety about falling, as it's worsened their motor functions, and they're being asked to exercise more, but they're anxious about the exercise because of the falling. How do we help people with Parkinson's through this?
So I often like to take a team-based approach to that situation. So the fear of further falling is extremely common. And so I think that our colleagues in physical therapy, along with our colleagues in the psychology world together, can be very helpful for this problem. Sometimes medication can help as well, but a physical therapist, especially one that is neuro trained and familiar with PD, can really help to reduce fall risk, maximize safety while walking, teach you safe ways to get your exercise such that your risk of a fall or a serious injury is very minimal. So that's an important piece of the puzzle. And then I think that therapy as well, and maybe Sarah can jump in here if she has anything to add. But I think trying to work with someone about how to manage the anxiety such that it doesn't keep you from doing things that are important, like the exercise. And sometimes just changing the type of exercise that you're doing. And again, that's where the physical therapist can be really helpful. There are ways to exercise with essentially no fall risk. It's pretty hard to fall off a bike, if it's a stationary bike, that is. So there are ways to get the exercise, even if you are a fall risk on your feet.
Absolutely. And I think that answers some questions I've been trying to answer in the chat as well. If you're concerned about certain exercises or PT issues, it's good to work with the PT to make sure you're doing it correctly, that it's at the level that's appropriate for you, and that it's not exacerbating any of your problems. But at a certain point, if you're still having anxiety, I think it can be helpful to work with a therapist just to learn things to help you calm down. I share with people all the time that even doing imagery where you imagine you're going to exercise and you kind of do like sports psychology and imagine yourself doing the whole thing and it's great and you feel great and you succeed, helps you go into that setting already feeling positive and less anxious. Breathing is another way that you can instantly calm your body down. So even taking a few deep breaths and pausing before you do something can help you kind of regain your focus and get away from that grip of anxiety. So it may be a combination that you need, but you definitely want to find exercises that you're safe doing. But if you need more skills, get help with that so that you're able to kind of help yourself through it.
And I have maybe something to kind of piggyback on what Dr. Lagerman said, a little bit different angle on it too, is that I think that when you engage in exercise, it's kind of a way of having more a sense of control over your life too. We can't control everything about our lives, and there's some things we don't have control over. But you can decide if you want to exercise or if you're going to exercise. Like Dr. Cloud said, almost everybody has some form of exercise they can do. And so if you choose to do that exercise and you build it into your life and build it into your schedule, you can feel more of a sense of control, like I'm doing something positive, I'm doing something meaningful to help myself. And I think that can make a difference in the anxiety you might feel. That it's not just a bunch of things you can't control, but there are some things you can control. And when you do it, then you feel better about things, and it's satisfying and can be really helpful with both depression and anxiety, I think.
Yeah, thank you all. I mean, I think that is a very key point, that our patients often feel a loss of control, and that contributes to a lot of these emotions. And then to answer some of the questions in the inbox of chat, what about the reverse situation where patients don't recognize that they have depression or anxiety or apathy, or the caregiver is concerned that the one with Parkinson's has those symptoms that they aren't recognizing? Like how can a caregiver help address this, help the patients get help?
I'll jump in and just say that oftentimes it's actually the spouse that clues me as the neurologist in that there's a problem. So, we ask our screening questions at every visit, but if you don't ask it exactly the right way, or if someone really has not a lot of insight into their own problem, if they don't recognize that they're depressed or anxious, we may miss that on our screening questions. I think the spouse, the children, the close friends are the most likely to notice a change in someone and recognize that there's a problem. And so that's why I think it's so helpful when people bring someone to their appointments. And we always encourage that because, often it is the significant other that says, I'm a little worried that he or she is depressed. So I think, soliciting feedback from those around you who know you well is helpful, and trusting that feedback, because those are the people in your life who have your best interest at heart and who know you the best. So, I think that's super helpful. And then also, I think neurologists and psychologists, we are always screening, and we maintain a high level of suspicion all the time. And so sometimes I think we can help someone to start to see some of the changes in their behavior. We can point those things out, and we can suggest that maybe they're depressed, and sometimes convince them to seek help. So it takes a village sometimes.
Maybe I'll add a little bit to that too. I think it's important as part of that is for people to recognize that having problems with depression or anxiety or apathy is not a character flaw. It doesn't say something about you as a person. Oftentimes it just says something about the medical condition you have and the difficult situation that you're in. And so I think sometimes people are hesitant to acknowledge symptoms that they may have been noticing or wonder if they're noticing, but a little embarrassed to bring it up, or maybe ashamed to bring it up. So I think it is, like Dr. Cloud said, sometimes helpful for a family member to, in a sensitive way, to maybe bring it up sometimes, or you if you're the patient yourself, to recognize that it can be just part of the condition that you're dealing with, and to be willing to be upfront and acknowledge when you're struggling with something. And sometimes that can be a big, important step to helping things get better and to finding solutions and helping your life be better.
Yeah, good. Thank you for very much. So just to dip into a little of the questions about medications, both sort of standard medications, I guess in terms of Lexapro being a specific type of agent that can help with a depressed mood, and comment on that. But also people asked about alternative medications such as CBD for anxiety and stress. Hope I didn't combine too many things there, but maybe someone can just talk about the treatments of this, both pharmacologic in the standard sense, as well as sort of complementary treatments.
Sure. So Lexapro is one of the most commonly used medications for depression and anxiety as well, because it is extremely safe, very well tolerated, has a very mild side effect profile across the entire lifespan. So we use a lot of it. But it's one of many medications in that class of selective serotonin reuptake inhibitors. There are many, many others. But certainly Lexapro is probably one of the most commonly used ones in the adult and geriatric population. The other part of that question, Brian, was about CBD.
Right, CBD or sort of
Mhm.
other pharmacological.
So I'll start with other pharmacological treatments. So there are other classes. There's actually several classes of antidepressants. I think the SSRIs are probably the most commonly used. We use a lot of another class of medication called SNRIs that work on both the serotonin system and the norepinephrine system. Those are also very safe, very well tolerated across the entire lifespan. So we use a lot of them as well. Older antidepressants like tricyclic antidepressants are sometimes used and can be very helpful. There are others. So I think the bottom line is there are many, many options. They can all be very effective. They're all generally safe. We pick the one for you based on all of the unique details of your situation medically. There is not really one that is best for all. In terms of the CBD, there have not been a lot of high quality, rigorous studies looking at its use to treat anxiety or depression in Parkinson's disease specifically. So I cannot answer that question with any, firm evidence behind it, but I will tell you anecdotally that in my clinic, which is mostly Parkinson's disease, quite a sizable chunk of my patients are using some form of CBD with or without THC in it for any number of reasons, but one of the most common ones is for anxiety. And so anecdotally, I know a lot of PD patients who use it to manage their anxiety and who feel that it is helpful to them. But again, we are lacking the big rigorous studies to really explore the long-term safety and efficacy of that.
So perhaps a question for Dr. Lagerman. I think it's interesting that a few of the questions have commented about different types of behavior, say aggressiveness or impatience or irritability. I think I hear irritability, but one of the most common things I hear about from a spouse about a person with Parkinson's. And I'm wondering, could those be signs of some of the mood disorders that we've been talking about today? And if so, are there some ways to help address that?
Absolutely. I've been trying to answer a lot of questions while we're doing this too. So one thing I think is key is just to talk about it. I think sometimes I was answering someone who said when they are frozen, they get really impatient with their spouses and family members. And just stating, I'm frozen, this is my worst time and I need more help now, kind of puts it out there. So it's not, you're trying to do something you can't do and the other person's expecting something from you that maybe you can't do. And that conflict is happening. I often talk with people that it's okay. Sometimes people find it helpful to name the Parkinson something, something silly, Charlie or whatever, but you just say, I'm really mad at Charlie today. It's driving me crazy or whatever. It's not the person, and the caregiver can hate the disease, but doesn't hate the person. So, having this other term you use for that can be helpful. I think you obviously can use things like your breathing to just help with anxiety or irritability in the moment. But you also may benefit from other techniques. Someone just wrote in here about the serenity prayer, but some people use like a rubber band or something that they can touch that sort of helps them say, I need a break right now, or I need a moment. So there's lots of different strategies to use. But I think when you see signs of changes in behavior like irritability or acting out or whatever it is, it's good to sit back and reflect, what are the triggers? Where is it coming from? And then think about how you can problem solve, how to work with it. So
one last question, and apologies to all those who have not been able to online answer their questions. Perhaps for Dr. Parkinson, we had a question about, if we're looking for someone to help diagnose and treat depression, apathy, anxiety, is it important that that practitioner be experienced in Parkinson's disease? Or do you think any mental health provider could be consulted?
Yeah, that's a great question. I think that if you find somebody that does have experience with Parkinson's disease, it can be very helpful because they kind of have a head start in understanding some of the things that you're going through. I don't think that it's necessarily necessary to have like a subspecialist that specializes in Parkinson's disease or movement disorders. I think that many of the things that we've been talking about in terms of managing depression symptoms and anxiety symptoms and apathy, and I also saw some questions in the chat about trauma and childhood trauma and other difficulties that I think that many counselors and many therapists are competent at treating those types of things. And so if you know of somebody that has specific experience with that, then with Parkinson's, then great. But I don't think it should stop you from working with somebody else. I think any good therapist should be able to help out with those things.
All right, well, thank you. Yeah, excellent. So we unfortunately are out of time. I hope people are looking into the chat to see that there are answers going up to the questions live here. We all want to thank our panelists for joining us today and all their information and knowledge. And thanks to all of you for tuning in today and engaging with the VCU Parkinson's Movement Disorder Center. And if you enjoyed this webinar, I hope you'll consider supporting the important research and therapies discussed today. Philanthropic support really makes a tremendous difference in advancing our work. So you can learn more about what VCU Health is doing by visiting our website at parksinson.vcu.edu. And I'd like to extend a very special thank you to Gary and Margaret from Power Over Parkinson's for joining us today. Where can everyone find you all?
Yeah, so people can find more about the foundation at poweroverpd.org. And of course, that provides a listing of events and resources that we have available to you. And as a final reminder, this webinar is being recorded and will be shared with you in the coming days. We thank you so much for participating in this informative webinar this afternoon.
All right, thank you all. Take care, be safe.